Khouri from the Media Studies program at AUB, and I am delighted to host this weekly show that we're putting on through the Communications Department of AUB to go over a range of issues related to the COVID-19 epidemic. And we're doing this from the AUB COVID-19 studio, which is putting out shows in Arabic and English every week. My guest today is Dr. Fadi El Jardali, who is one of the leading practitioners of what we would call academic outreach. He's a professor of health policy at the Faculty of Health Sciences and the director and founder of the K2P Center. K2P is Knowledge to Policy. And what they do is they gather research, they do research, they analyze it, interpret it, and present it in forms to the public and the media and the government that can be made use of. And we will go during the show to New York, where Alison Freeland from the AUB Communications Office is there, and she will be talking to us about the questions and comments coming in from the audience. Alison?
Dr. Jardali, for being with us and for doing this briefing. We're all around the world dealing with the same questions. And I think the report that Dr. Jardali just put out is applicable to all of us. And I'm excited to hear the discussion today. And on behalf of the AUB alumni and friends around the world, it is wonderful to be together, and I will be sending comments and questions as they come in online. And if you're watching live on Facebook, feel free to use the chat and we will communicate the questions, as many as we can. Thanks so much.
Thank you, Fadi, again for being with us. There's many things that we want to go over. Let's just start with this quite extraordinary series of publications that your center has started putting out about 3-4 weeks ago. Every 4 or 5 days you put out one, and you put one out yesterday, which we'll talk about shortly. Tell us, it's called the K2P COVID-19 Series Initiative. What is it designed to do? Who are you trying to reach? And what are you trying to tell the world?
First, thank you, Rami. Thank you, Alison, for having me today, and thank you for leading the AUB COVID briefings. As you know, Rami, the world is really passing through the worst public health crisis ever in recent history. And it's always in a crisis, people should always look at a trusted source of evidence, a trustworthy source of evidence that can actually make a difference at a time of crisis. The Knowledge to Policy Center at the Faculty of Health Sciences of AUB, the mandate of this center, in fact, is really to synthesize, harness the existing evidence, data, and information and knowledge, put it out there to the policymakers, stakeholders, and all practitioners and in order to help shape, inform, and influence their policy decision. Why we have done the K2P COVID-19 Rapid Response Series, as you know, also at a time of crisis, you need to rapidly respond. Swift response matters. And including how we are providing and transmitting evidence to policymakers. What we have seen in Lebanon and the Arab world, that in fact there has been confusion and inconsistency across different countries of how they are actually dealing with the pandemic response. One of the, as you know, health is really a political choice. Mm-hmm. And I think even part of what we have looked at, some countries have made wrong political choices by underinvesting in public health preparedness and public health response. That's why we have seen some inconsistency and gaps. So what K2P has done, we created this initiative in order to provide a rapid response to tackle some of those policy priorities, particularly how to inform countries about how to better respond systematically and in an evidence-based way in tackling the pandemic and limiting the transmission. So we looked at what countries are doing, particularly in Lebanon, what are the gaps. We build on the good things that they are doing, but also we added additional evidence in order to inform their decision. And this is part of the social responsibility of a center like this, among other centers as well, that can help and shape and influence policy.
We'll talk about the university's social responsibility later on. I'd like to ask you to talk about the two dimensions of this work. Where do you get this knowledge that you package and analyze and send out? and who are you aiming at the other end?
Yeah. So the K2P Center is actually a designated center by the World Health Organization. So it's a WHO collaborative center for evidence-informed policy and practice. And this is the second center in the world after the McMaster University in Canada. So we are specialized centers in actually knowledge, it's called knowledge translation. So how to identify policy priorities, how to synthesize evidence, how to package evidence, how to engage stakeholders in a dialogue and collective problem-solving approaches, and how to advocate to change policy, and how to help implement real policies and real practice and actions.
So when you talk of policy, are you only talking of government policy, or are you talking about media, private sector?
So one thing before I go to that question, in terms of the process, there's a detailed protocol and SOPs, a standard operating procedure of how we look at evidence. We always look at high quality evidence. We don't put any type of evidence that is really out there, because wrong evidence or miscommunication is a matter of life and death in public health. So we have to be careful about that. We have a thorough quality control process of what gets out. We look at systematic reviews, high quality evidence, a lot of protocol of how we get evidence. And we look at evidence, knowledge, and tacit knowledge. We also engage with policymakers and stakeholders to identify priorities. Now, when it comes to policy, it's not really, I do believe that sometimes we have a lot of examples of policies that get identified, developed, produced at the national level or at the central level, but it actually fails at the level of implementation just because you haven't engaged the right people. You haven't engaged policy implementers. You haven't engaged practitioners. So what we focus on is not only to influence policymakers, stakeholders, but also to work with policy implementers, street-level bureaucrats, frontliners. And in the COVID-19 series for the rapid response, we went to the municipalities, we went to the hospital directors, to chief medical and nursing officers, we went to primary healthcare centers, went to the communities, went to NGOs. So it's not only the committee that is governed or chaired by the Prime Minister or the Ministry of Health or other ministries. So it's really, you have to look at the more of a transmitting this in a top-down approach and bottom-up approach. So when we look at policy influence, we don't only focus on government policy and trying to change it there, but also to influence as well the demand from the community and how that should shape also policy discourse and policy discussion.
And this includes the media and private sector as well?
Yeah, so we have interesting what you mentioned about media, and I think we have more to do with media, and you are really a prominent journalist and columnist, Rami. We always learn from you. But I'm sure you will agree with me that media play an important role, both at the level of accountability tool, awareness tool, and advocacy tool. And what we would like to see more and more those active engagement of media. So what we did at K2P is that we have developed small products called Media Byte. Just in one page, written in a very easy lay language. What are the key things that a person writing an article about university healthcare coverage? What do they need to know in order to shape public opinion? Media play a very important shaping public opinion, but we need to promote more evidence-informed health reporting. We need to make sure we invest in also having media and journalists and reporting that is really linked with evidence and use evidence as part of how they shape stories.
Mm-hmm. So let's get right to the question that everybody wants to know about and what you've dealt with. This report that was you issued yesterday, Exiting the COVID-19 Lockdown, a Roadmap for Action. This is quite an extraordinary document. It's only about 16 pages, and it's written in kind of a lot of bullet point and box format. It's very easy to go through. But I read it this morning sitting on my balcony overlooking Beirut and the Mediterranean and the mountains, and reading this and saying, well, when will we be able to go out and enjoy everything that Beirut and Lebanon offer us? And then this report has an extraordinary set of detailed analyses, and you did this by collecting the best available information from the whole world, from Hong Kong and from Canada and from everywhere else. So tell us about this report, and is this sort of does this epitomize what you are aiming to do in K2P?
Yeah, so because this is really a series, so you have to be, we have to be engaged in every step in this process. And as you know, the issue about pandemic response is really, it's a marathon and sprint at the same time. And the question is really what type of intervention you have to do at the different levels throughout this pandemic crisis. So starting by informing response, to working with supporting hospital, primary care centers, community-based approach. But I think what the question you've asked, I think the whole world now is asking, when do it's time or safe to start easing the lockdown? What are the measures? What need to be, what are the steps? So what we have done, it took, although it's actually a few pages, but it took significant amount of effort and time because we systematically looked at all the evidence that is really out there, and there's a lot of uncertainty around certain areas. We look at all the practices currently being deployed by many countries. We look at the preferred practices, and we put it in a way for governments to actually, if you look at this, actually it can be transformed to checklist. It's you know, a tick box. If you, do we have this? Do we have? Can we move this? So we've done it in a way, in a very, very. That's why I call it guidance. So we're really guiding the government strategy in terms of the exit. But one thing we've learned from that you know, this is of course people are now becoming impatient, but this is a long battle. And part of winning the battle is actually to make sure that people understand very well the nature of this pandemic and the risk of actually doing any premature step to ease the lockdown. And that's exactly what we try to do in this document, that what we're saying that you cannot ease lockdown without a clear, detailed, and evidence-informed strategy of how to do that can keep people safe and prioritize public health. Economy is important, but still the actually health risks are major. So if you see in this document, these are 3 steps. The first one is the country ready? Are we ready? So that the readiness phase, and it's very clear what are the steps that each country should ask. Second is the initiation, putting the plan together in order to this. And the third one is the implementation. And we detailed about each of the steps. What are the targeted intervention that you need to do? How you can start opening a little bit the economy by focusing on essential services versus non-essential services. How to make sure also you keep supporting the population during this phase, because as you know, Rami, I mean, you cannot tell people to stay home if you don't also provide support, social, financial, as part of the economic plan to actually also, support people during this phase. So wanted also to mention this as part of this, part of the compliance of citizens for the step-down measures for the easing the lockdown is really how much government is also supporting citizens when they are staying at home. Right. So it goes both ways. The worry here is that if a government actually develop exit plans without a clear systematic approach, without a clear detailed surveillance, monitoring and reporting and vigilance, we might actually end up with probably second or third wave, and sometimes maybe if we're not prepared for that, we'll see surge in cases, and we will see also overburdening of the existing health system, which might lead us to something that we were trying to avoid till now, and we have succeeded in Lebanon to do so. So it's important, and I'm not saying this because this is a document that AUB produced, but I'm saying this because it is the exit strategy should be very, very thorough, very detailed, well thought of. What type of businesses open first and versus second, when people go to school, I mean, all this is really very much detailed in this document.
Yeah, I was amazed when I read this with all the very nuanced details. What you just mentioned, things like you can have the primary school kids go to school first, and then staggering the working hours. Yeah. Some people work 4 days and then they're off for 7 days. So there's an incredible amount of information. But then at the very beginning, you hit us over the head by saying, at present, there is no scientific consensus or guidance on how to exit the lockdown, with no broadly agreed benchmarks for what constitutes safe conditions for returning to normal life. In other words, this is a scientific study that we're all involved in.
Yeah, and I think many countries are actually facing this. If we look at the case of SARS and Ebola, the scale of those cases, epidemics, were not as big as this. That's why we don't have evaluation studies. So we would love to see now countries that have actually succeeded in easing the lockdown, and evaluation of that, and actually more high quality evidence that can be used with it. But the lack of conclusive evidence, it doesn't mean that we don't have evidence or enough evidence to act in an informed way.
Right.
And this is what is. There is nothing called perfect evidence, Rami. You know this very
Right.
well. But there is good enough for you to start from and actually learn and adapt as you move forward.
Okay, Fadi, we have some questions from our alumni, I think. Allison in New York.
Yes, we've put a link to the report on the Facebook chat so that people can see the work that you've done. And there are two questions. One is, will AUB play any role in the implementation of getting out of the lockdown? And also, do you have expectations that the Lebanese government will be looking at this report?
Certainly, when it comes to the first question, and I have to say, there is a lot of entities, faculties, centers, at AUB that is really doing fantastic work. I have to say, and I really give credit to every single entity and people and academic and scholar that is really working in this university. They are doing fascinating work during this period, and I do believe that the whole is always greater than the sum of the parts. Right. So yes, I think it's more and more, and many people are really involved in national committees, in certain task force, conducting research, raising awareness. There is the expert committee that I'm privileged actually to sit in the experts committee, among other initiatives. Yes, we see AUB is actually engaged, and based on the experience, it's an engaged institution. And I'm proudly say that, this is something that we can build on it to actually take this forward. But certainly, there is an engagement one way or another. Now, in terms of the implementation, to go back to this, I know that the people that are really working with government and government advisor already have this report, and I received some very good feedback from them in terms that it's very detailed, very thorough, and it also helped inform and shape the strategy. And to give credit as well, there is a lot of other experts working in the government committee now that also helping shaping the strategy. It is a collective effort. It's not one entity effort. I think the question really is to find our space where we can contribute and actually join efforts in order to make a much more robust response and a robust strategy. That is really what is critical about this pandemic crisis. No one can do it all. Joining forces, coordination, harmonization is the key, and we're hoping that we are actually playing a role in that.
Did you have another question, Allison?
Yes, I do. Thank you. I wonder, Dr. Jardali, if there is one area of the globe where you are finding really good and consistently helpful evidence that you're using. Is there a certain part of the world that is contributing a great deal to this knowledge base?
I have to say that there is really a lot of information and knowledge and data coming from different regions across the world. So I wouldn't say really even one country. Now certainly the country that they were hit first, I have to say, there was a lot of lessons learned from China, from Taiwan, from Singapore, because the first wave hit them there before us. So there was a lot of lessons learned from there. But if we look now at what's happening in Europe, even in the Arab countries, the Gulf states, even some of the low-middle countries, even in Africa, South America, you will see also there's a lot of contribution to the existing body of knowledge when it comes to pandemic response. But amazingly, I'm seeing a lot of commentaries and a lot of academic articles that are really put out there and providing more of a real-time evidence to build on what we know so far to take it into the next step. And I think many of the journals now are facilitating as well a quick publication of some of the COVID-19 related article, which also great, providing free access, etc. So we're seeing bits and pieces of different initiatives. I wouldn't say there is one country. I would say that all the information that are being generated, that are trusted information all over the world, are extremely important, because no one country actually have the full picture yet. Let's not forget, we're still in the middle of the pandemic. There's a lot of uncertainties, a lot of questions unanswered, and it's very important to be curious about those questions. And this is also a call for research funders as well, is to be flexible and try to as well reach out to researchers, academic institutions, in order to actually try to mobilize efforts, invest in some of the critical questions that need to be asked and that we need to get answers for throughout this crisis.
From your experience, do you feel that in Lebanon and throughout the Arab world, which you know well from your work, that government officials actually are interested and able to absorb the kind of knowledge that you pass on to them and other academics and NGOs and international agencies do? How well do they take this knowledge? And therefore, the second question linked to this, you just published a report about Lebanon's response to the COVID-19. How do you assess Lebanon's performance so far?
So if we go to in the Arab countries, I mean, based on the experience that we have done before the crisis, unfortunately there was always the political and economic priorities comes first, and when it comes to the public health. And I still believe, and that's what I mentioned early on in the interview, that I believe many governments have made political or wrong political choices of underinvesting in public health. And I do believe that the best investment ever any government can do these days is investing in public health, because it's about national security, it's about economy, it's about many things. So, but when I mean they underinvested in public health, Rami, meaning that in fact there hasn't been a lot of public, the integration of public health expertise in the policy-making process is not yet there.
Right.
And I think it's a wake-up call as well now for government of how to reimagine the way we're going to link with public health expertise at the time of a crisis like this, how to institutionalize the use of evidence in public policy in general, in health policy making in specific. So there is a lot of opportunities for government. In fact, that's why, as I told you, there was a lot of inconsistencies across many countries. Some they followed WHO guidelines, some they actually looked at the experience of other countries, some they were policymakers, some they were policy takers. But this cannot happen. There's always trade-off, but this cannot happen at the time of crisis, because again, it's just, you have to have a swift response and you need to be proactive rather than reactive. So that's an important thing that we need to also invest, increase the number of public health experts in the region, invest in more public health research, but also integrate public health expertise in decision making. This is also important. Now, when it comes to the Lebanon response, and I have to say, and looking really objectively, and we, as a K2P has been always a neutral. So, and I think this is very important also to build trust. So you be neutral, you be objective, you put the fact out there. But let's not forget, Rami, the crisis hit Lebanon at the weakest moments in the recent history.
Of course.
We had the October 17 revolution, we have the economic recession, we have political crisis, many things, and now we have the pandemic. So why I'm saying that? Because whenever we say, how the country is actually reacting, we have to understand the context very well. We have to understand that the state is weak. We have poor capacity. We have limited resources. We have limited trust of people in government and public institutions, which now I'm hoping that, more trust will be revived in public institutions after the experience of Rafi Hariri Governmental Hospital. So when we look at this, yes, and we put it in the document, the first document we produced in the series, Lebanon was a bit late in actually, and I want to say late meaning in terms of, because there was a more of a political consideration, economic consideration before health at the start. That's why there hasn't been a lot of preparedness before. But to be honest with you, looking at all what we have seen that with the limited resources and the technical expertise that's available, Lebanon have done a reasonable response that is really engaging. They harness the power of the community. They engage with the non-state actors. They, went a little bit to empower more the municipalities, work with NGOs, with the private sector. but there is a lot of lessons learned in that, Rami. The private sector, we don't have a clear partnership framework for the private sector, and this is a big concern in a country where most of the service delivery is provided by the private sector. Although there was some key champions in the private sector want to actually offer help. The same thing for the NGOs, the civil society groups. So we would like to see this crisis and an opportunity now to revisit the framework that govern non-state actors in Lebanon and how we can use this as an opportunity to improve. So lots good successes, reasonable response in some areas, and I have to give credit to citizens because also people played an important role also in trying to comply despite some of these challenges, and despite that some people are more vulnerable and we need to do more of that, and some people unfortunately they don't have financial support. Right. So it's a fair response so far, and we haven't won the battle yet. Right. We're still, and if we want to win it, we have to engage more and more at the level of community.
Right. We have more questions from New York.
Yes, one logistical question. In many places in North America, for instance, we're getting daily briefings from governmental officials. And there's a question about how and if the Lebanese government is communicating on a daily basis with people. And if I could just slip in a second question, it's about, it's totally different, but it's about your concern, Dr. Jardali, on the if there is a second wave of the virus, and your thoughts on that, how the Lebanese people should handle that.
So when it comes to the daily briefing, I fully support this, and I actually at the beginning of the crisis we mentioned that the best way to reach to people, to help them understand why we need to do those stricter measures, why we need them to comply and to actually stay home. The best way is actually to have a conversation with them, to actually brief them on a daily basis by a trusted source of a spokesperson that actually can speak by getting all the data and information and making sure that the people there is transparency and there is openness, but also the sharing of information. We haven't seen that. We have certainly there is different committees working in Lebanon on this. I would still believe and think that a daily briefing to the public is extremely important. You mentioned about North America, for example, Justin Trudeau, the Prime Minister of Canada, on a daily basis at a certain specific time during the day, he goes out and actually update all the Canadians about the status of COVID, the cases, what the government is doing. You see, the point of the daily briefing is not to say how many cases tested positive. This is not daily briefing. This is more about just transmitting information that many people know about. What people know about, they want to actually feel safe. They want to feel that they trust the people that are governing this crisis. And that's why, and they want to see also government response and support during this crisis. So daily briefing is extremely important and should be from a person that is really heading a committee or a prime minister or whatever, but it depends on a country specific component. But I would say this is extremely important to build trust and to help with people compliance. So this.
So now go ahead.
You mentioned, I think there is a second component about the second wave. Well, we know if you look at also what we're seeing now in China and Singapore, you would expect now that once you start easing the lockdown, you might it's a bit of a trial and error. You might actually see some new cases. There might be measures that need to be taken later on. That's why in our document we mentioned that clear monitoring and surveillance is extremely important during this phase. But again, we can delay that wave 2 or wave 3, and hopefully we'll not get that. There a lot of efforts can be done to delay it, but one would expect, given that what we know about this and the experience of other countries, one would expect that. The question, what are we doing to mitigate it, to prevent it, and to delay it?
Fadi, we only have 1 minute or so left. You're talking now not just medicine, research, knowledge, you're talking politics. You're talking about people, communities, governments, trust, communication, listening to each other. This is a new world that you are talking about, and is this something that you think might come about as a result of this pandemic?
Yeah, I do believe, Rami, that the best way to change and influence policies is by having an informed citizens and informed communities, and this doesn't come from top down. So we have a role to actually raise the demand for citizen engagement. We have a role to raise the awareness and providing citizens with the right information in order to actually try to think about who they would like to vote later on in the election. How are they going to hold the government accountable? How are they going to speak to the people that are really in the community? So I'm hoping that, and we should, in fact, take this crisis as an opportunity for revisiting how we think about citizen engagement, for reaching out to the community, to the actual doers, to the people at the front line. Those are the people that can make it or break it at the time of crisis, and we need to know more about their needs, their priorities, and to engage them in the decision-making process.
And when this, I'm told we have another couple of minutes, in terms of what's going on now, broadly speaking, in the region, especially in Lebanon, this tremendous economic devastation that the whole region has felt from various causes, oil prices, lower economic activity, shutdown, etc., and the pandemic. Once life slowly in stages goes back to something like it used to be, there's going to be huge increases in unemployment, poverty, inequality, marginalization, hunger, desperation. So this battle now between economic activity and good health care.
Yeah. There's always a trade-off. I mean, if you ask now epidemiology, would say, well, definitely all what we have been seeing and doing is important. We should continue. From an economic standpoint, maybe the argument might be different. But Rami, I think what is important for government now to understand that I think we have to look at it as an inverse U-shape. That now we are the country really at the weakest point. Countries in terms of pandemic, people are complying. But I think what might happen after, the COVID will pass. But a lot of inefficiencies in our political, social, economic, health, and education system will persist.
Right.
And which means that people will actually start, I would see some political unrest, I would say, and this is my personal opinion, because the government now need to really think not only in how to respond to the pandemic crisis, but how to plan to post-COVID-19 crisis and what that means for the society. Right. There's a lot, many people are unemployed now as a result of that, reduced income, purchasing power, currency exchange. I mean, all this will, come together at some point, and governments need to be ready for that.
And this raises questions about the role of AUB, the role of universities, research centers. We have expertise across many fields. This expert committee that you serve on is quite an impressive example of how you bring together expertise from different sectors and have them work together to provide the kind of input that is needed to help achieve a better situation for the country and all of its people. Do you see any signs in your field or even wider arenas about the desire to have greater collaboration across disciplines?
Yeah. Not only desire, we will see new models of collaboration. We have now to start thinking differently. As I told you, the whole is always greater than the sum of the parts. And now the real test of what we are really seeing. And health is not only public health, is not only Faculty of Health Sciences at the UB. It's really related to all the faculties, all the entities in the UB. And we're starting to see very promising signs for more collaboration, synergies, alignment. I think this is extremely important. But let's not forget, Sustainable Development Goal is really about all sectors looking at health from a different perspective. They are the multi-sectoral approaches to dealing with this. We cannot talk about health without talking about education, without talking about the economy, without talking about the environment, among others. So I'm hoping that this opportunity also will allow us to really rethink about a new model of collaboration within AUB, a new model of research funding. I think there's a lot of space for innovations here. Right. And I'm starting to see that. And I thank President Khoury for actually putting the expert committee for COVID-19. Right. And it's a great to actually see and work and collaborate with different entities, different faculties, different disciplines, and to learn from them.
Right.
Because again, it's really about shared learning, more joining efforts in order to better respond, and also to help the AUB community to suffer less as a result of the crisis, and also to inform some of the national responses. And I'm privileged to sit in this expert group.
Well, if we want to also be daring, we can think about expanded roles for students, undergrads and grads,
Absolutely.
and alumni.
Absolutely.
And there's all these communities that are part of the university, along with the faculty, who can play an extraordinary role. We have one last comment from New York before we have to close up for the day.
Yes, thank you so much for this, and people online are finding it very informative and helpful. And just one last question, in the spirit that you're talking of collaboration in a country that is known for being divided politically, I'm wondering if you're seeing more unity in the political sphere as they address COVID-19, or if there are all those typical divisions.
I mean, this is a question that we can answer it actually in a much lengthy way. But in short, certainly, I think I'm so happy and pleased the type of for again the collective approach of how we are actually providing the response and the collaboration from different sectors. But I'm seeing, certainly we're seeing more unity, and we want to build on that. We need to actually sustain that. This is not only at the time of crisis. At the time of crisis, crisis always looked as an opportunity, despite that there is some losses. But it will be a missed opportunity not to take that crisis as an opportunity for Lebanon to revive. We see it reviving trust in the public institutions, reviving trust in the government, etc. So, and also having people from all sectors, all disciplines coming together, united in order to actually provide. We've seen really tremendous voluntarism as a result of that. You mentioned about students, Rami, and we're seeing really, students, activists, people that we work with, they know about us. We get some requests that the people would like to help. They would like to do something. They want to stay home, but they want to feel that they are making a difference in the future of this country. Right. So absolutely, this is an important question, and I'm hoping we can build on this, strengthened, notion of this unity in order to actually move into the next step post-COVID-19.
Just before I came here for this, I was watching 2 hours of the IBDAع, the annual event that Najat Saliba and her students and many other faculty all over Lebanon now, colleges all over Lebanon, where students come up with projects for environment and climate change, and women was the theme. Extraordinary ingenuity, creativity, and really practical
engagement students and real world.
Students did this, undergraduate students did this completely on their own. They're just super impressive. We have one last question from New York, and then we wrap it up. I know this is the third time I say we wrap it up, but this time I mean it.
Dr. Jardali, now that this report has been released, what are you working on?
We are working, actually, there are many, we're working on something related to the use of technology and the ethical use of technology at the time of crisis. We're seeing now many countries are leveraging on mobile apps and others in terms of contact tracing and surveillance, but there is also a lot of privacy issues. So what that means for low-middle income countries that, with the digital device. We're working on something related to cancer and COVID. So there are many areas, but we leave some flexibility for some of the emerging priorities. As I mentioned to Rami, sometimes to actually on a daily basis monitor what is really happening and see, okay, this is where an area we can contribute to and within our mandate and within our terms of reference. So we'll always leave, so maybe next week we might be working on something that we haven't really planned with it now, but something might happen in the next 2 days that will allow us to actually prioritize. So that's a there's always a flexible approach to prioritization.
And you still find time to teach?
And I enjoyed teaching. Unfortunately, we're not having the opportunity now to actually see the face-to-face with our students, but our students community at UB very much engaged, Rami, and I'm hearing not only at the Faculty of Health Sciences from other colleagues, people are attending the online session, they are participating, there's always interaction, and I think we need to really think, I mean, this opportunity also allow us also to rethink also about modalities of teaching at some point. We were talking about before the session started, modalities of collaboration. So yes, it's a bit challenging, but it's always a learning experience. And I think something that we can reflect on it more and more.
Well, my experience, Fadi, with you over the last 12 years is that engaging with you is a learning experience and a great joy. And we're very proud of what you and your colleagues have done.
You are one of the mentors, and we always learn from you, Rami.
Thank you. Thank you, Fadi. That's it for today. Thank you to the communications staff here in Beirut and in New York, and the technical staff and everybody who's been involved with this. I want to just say that next week our guest is going to be Dr. Mazen Al-Sayed. Mazen Al-Sayed is an associate professor of clinical specialty, and he is working in the Department of Emergency Medicine. He heads that department, I think, at the medical center at AUB. So we will get a view from the emergency room about what's been going on in the last month and a half and what we're learning from on-the-ground experiences there. That's it for our Beirut AUB COVID-19 briefing. Thank you for being with us. Join us again next week, same time, Wednesday, 6 p.m. in Beirut and 11 a.m. in East Coast, North America. Bye-bye.